there, my name is Kim and you are tuned into Kim E, the Diabetes MP. This is the Patient Corner. It's a segment that I created for those who have diabetes or loved ones that have diabetes that are looking to learn more about the diagnosis. Now today we're going to talk about proper foot care. This is one of those important things that all diabetics need to know. Every diabetic needs to know how to monitor their feet, and so let's get right on into the video. Now, proper foot care is so crucial, and it's crucial to every diabetic, okay? One of our main desires or our main goal here with foot care is to prevent complications from happening. Now, with the feet in a diabetic, you typically are looking to monitor for neuropathy and even to prevent amputations from occurring. Now that is on the far end of the spectrum, but this is the reason why we want to make sure that we're monitoring our feet daily. We're looking at our feet and we're taking care of our feet. And that's really the case for any complication. We're trying to prevent any complication from happening, decreasing your chances of even having it. And if you've already developed a little bit of that complication, trying to stop it in its tracks. Now, I have made a ton of videos over diabetes and its complications, and I'll go ahead and link that the whole playlist down in the description box so you can look at those videos after this video. But let's get into the steps that you should be doing every day for your feet to take care of your feet. Inspect your feet daily. Now, what we're talking about this is simply look at your feet every day. Okay, look at your feet. Make sure that your feet don't have any redness. You want to make sure the feet has no redness. You want to look at your toenails, making sure that they look supple, that they look healthy, making sure that your color looks good. You want to look at your feet, making sure that you don't have any nicks in between your toes on your feet, anything, any sores, any potential for sores to come up. Properly clean and dry your feet. Now, when it comes to cleaning and drying your feet, you want to make sure that you're washing your feet daily, and that when you wash them, that you're getting in between the toes and making sure that your feet are completely dry. The reason we're doing this is because we're wanting to make sure that we're not leaving any moisture around that fungus and bacteria can grow, okay? We don't want to have foot infections, and when you're a diabetic, you're more prone to infections, especially down in areas where it's going to typically be covered, dark, moist. You want to make sure that you're starting out with clean and dry feet. Look at your nails, calluses, and corns. Now, I already mentioned looking at your feet and inspecting your feet, but one of those things too is making sure that that your nails are trimmed. And you may not be the best person to trim your toenails, because here's the thing: if you trim too low, you may nick yourself, and we've already discussed that you're more likely to have an infection. So going to a podiatrist, going to even a place that does pedicures, and making sure that they file your nails down, that's a safe route for you, okay? But if you feel that you're confident enough to file your nails, I would first ask your podiatrist to show you the proper way to do it so you can do it at home, okay? But you're also wanting to make sure that you're looking for corns and calluses on the bottoms of your feet, on your toes. And one of the ways that you can definitely prevent this is making sure that you're wearing cotton socks and properly fitting shoes. Wearing tight shoes or uncomfortable shoes that don't have good padding will definitely cause that rubbing and cause corns and cause calluses. So you want to make sure that you have properly fitting shoes. And lastly, make sure that you are protecting your feet, okay? So again, wearing properly fitting shoes definitely will protect your feet, and even wearing something around the house, not walking around the house barefoot, making sure that you're paying attention to where you're planting your foot and you're walking so you don't clip yourself on the couch or on a table or something like that. Not walking outside barefoot, making sure that you always have good shoes on, and even with your shoes, shaking your shoes out every day just in case something might have gotten into your shoes, like a little rock or a pebble or something like that. Because if you're walking on that all day long, then that can definitely cause some redness, can definitely cause some discomfort. And as a diabetic, your body's not going to respond as quickly and recover from it as quickly as someone who does not have diabetes. Now, these were just some basic tips that I tell all diabetics. Again, this is the general tips, but there's other things as well. And so again, I encourage you to follow up with your primary doctor. I also encourage you to follow up with a podiatrist and have a great relationship with both of those disciplines. You have been sitting here with Kim E, the Diabetes MP, and the Patient Corner, and I will catch you on the next video.